Hello there, it's Dr. Shelley, and we are about to start a series on peripheral vascular disease. We're going to start with peripheral artery disease, and this will be a series of videos because it's such a broad topic. I mean, everything on my board behind me is basically like risk factors, right? And then a little bit of a compare and contrast, arterial versus venous, because that's usually a big part of some case studies that you might come across on your NGN NCLEX exam. Now, for those of you who've already purchased this self-study, we are working in, and you have a couple of choices for this particular handout. You can either approach it from the cardio side, and so if you have the cardio bundle, which includes the cardio and this one, it's this peripheral vascular disease packet handout that we are working in. But if you can't find that, because, you know, shit happens, then you just need to know I put very important handouts in more than one packet. So if you have a diabetes packet, you can also find this handout in the back of the diabetes packet. Now remember, you can find all of these things on my CHELLYS NCLEX Prep Shop. So if you just went to HETV on YouTube, you'd see the link for that. But let's get started because it's a lot of information and it's going to be a fairly decent, lengthy, maybe just a little bit. I'm sorry for all you ADHD people. I get it, but sometimes you just gotta break it up a little bit, go take a break, come back and finish the video. But this will be a decent sized video because it's such a comprehensive issue. So let's start, shall we? Let's look at the issue of peripheral arterial disease. Remember, the big topic is peripheral vascular disease, and we always break stuff up in this class. We make sure that we understand peripheral generally means your extremities, and that when you start talking about vascular, you could be talking about veins or arteries. So we're being specific. This type of peripheral vascular disease is specifically peripheral arterial disease. And you may even remember in school when you went through your cardio lectures, if you got a lecture, right? Maybe you got a couple PowerPoints and we're told to kind of teach yourself. That's why we're all here together, because nobody really learns very effectively that way. But if you were blessed like me and actually had an instructor that taught you very well in your cardiac lecture, then you might remember learning something called modifiable risk factors and non-modifiable risk factors. So let's dip right in, because here's what we're saying. When we look at peripheral arterial disease, we're saying anything that takes the artery in your extremities, the peripheral part of your body, not the central part of your body, but the periphery, your legs and arms, right? Whatever affects those arteries and narrows it and makes it harder for blood to move through. And what is blood? Oxygen. Blood with oxygen is called perfusion. So watch this. With peripheral arterial disease, decreased O2 and blood perfusion is called ischemia. You've heard that term, right? And ischemia is very serious because ischemia could lead to necrosis, which is death to tissue. And then death to tissue can lead to death to the limb or body part because of gangrene, and could facilitate you needing an amputation. And we always make a point of saying that amputations are preventable. The fact that we see so many is just sad because amputations are preventable. And remember the way this works, okay? From the date of the amputation to 2 years after, that patient is usually dead. Yeah, because the worst thing you can do to an elderly person is impact their ability to move. When you affect an elderly person's mobility, you kill them slowly but surely over 2 years. And that's true for hip fractures or amputations in patients who are older than 65. So a lot of your patients will actually have this history, and it will be just from peripheral artery disease that they got this amputation. So that's why this is so serious. So when we look at the modifiable and non-modifiable risk factors for peripheral artery disease, we must make sure that we look at what could cause that blood vessel to become narrow, decrease the oxygen and blood supply to the limb or the extremity, and then end up causing some ischemia and subsequent problems, right? So let's take a deep dive, okay? Let's look at the modifiable risk factors. Of course, smoking is number one. I mean, come on, we already knew that. But sometimes we should never assume. So I'm not going to assume. I'm going to teach you like I teach everyone, which is really basic so you understand just how serious smoking is. And let me just say from the outset, it doesn't matter what you smoke. It could be pot, it could be a cigarette, it could be whatever, but let's be clear here. Whatever you smoke is going to cause the following problem. When you smoke a cigarette or a joint, you are going to have 1 whole hour of what we call ischemia, or your blood vessels vasoconstricting. In other words, the blood vessel that should be wide open, it becomes really narrow and vasoconstricted. And that means that you're going to, for a whole hour, decrease the oxygen and blood flow to that limb area, part of the body or whatever. Now, obesity is huge, right? We know what we call it. We say that it is a BMI greater than 30. And that's important because BMI is taken into context your height and your weight, not just your weight. And so when we look at the American person, the typical American person, 80% are either overweight or obese, and that is frightening. And it is a big, huge problem. It's because we are working so much that our diet sucks. We don't eat whole foods. We never cook. I mean, the amount of people that don't even know how to cook is shocking, because most of us, my age, 60, learned how to cook from our parents, but now parents are nowhere to be found because they're so busy working to pay these bills in a society where the rich are getting richer and the poor are getting poorer and the middle class is disappearing. Yeah. Okay, so just be real with it. You don't really eat right. We already know that. And what we eat causes us to gain weight, especially in our abdomen, or that's called what? Truncal or central obesity. That's going to put immense pressure on our heart to pump through all that. So all obesity is not created equal, but this obesity specifically in the abdomen is really bad. And I just want to make sure you know that that is part of what we call metabolic syndrome, right? Okay. High sugar and trans fats. If you've known me for 15 seconds, you know that I'm a low carbohydrate girl. I'm not as extreme as keto, although it has its benefits. I just prefer to keep it really like not too extreme. I just don't eat a lot of carbs, right? That's critical for a patient who has modifiable risk factors to understand pop, sugary drinks, and trans fats. I mean, sugar in general, right? Any way you bring it. The amount of sugar we eat in this country is retarded, like 20 teaspoons a day. But the trans fats is something that you may not know what that means. Trans fats are cookies, cakes, crackers, pies, chips, basically any processed food, even biscuits and rolls in the can that you bake, you know, for holidays or whatever. Those types of foods are super high. Oh, the worst, microwave popcorn, which is my bad treat. Also frozen pizza and a lot of frozen biscuity type of things. So I want you to know that trans fats are and really have been a big problem in our society. And I'll tell you something, if it's on the shelf and it's a baked good, and it wasn't baked in the bakery fresh, and donuts are some of the worst. And I love donuts. It's my favorite kind of treat, like for real. But donuts are the worst. So if it's on the shelf and it has an expiration date of Juvember, it's a trans fat. Just call it what it is. Hostess Twinkies, whatever it is, all those baked products that are good forever on the shelf. That should tell you something ain't right about this shit. Okay, how about our stress level? Oh God, remember how cigarettes vasoconstricted or caused ischemia for a whole hour? Well, you guys, stress causes the same exact action on your blood vessels. When you're stressed, you have something called catecholamines, and they close down, shut down, slap down your vessels, and you get decreased blood flow. You really have a problem if you're chronically stressed. Some stress is good. Now, don't get it twisted. Stress made you pay attention to this video because you don't want to fail your NCLEX. Stress made you think that I'm not just going to leave out of school and go take a test that I haven't studied for. You know, stress can be good. The stress of your bills will take your butt to work and make you pay them, okay? So you don't be homeless. I mean, you know, some stress is good. Most stress that we continue to have every single day, like those bills, because you are living outside your means, or you had to be the nurse with the purse, or the Sag with the bag, or whatever your little deal is, Hank with the bank, whatever it was, because you thought nursing meant big bank, which it does unless you spend it all. That can lead to more stress. Like IRS is no joke. When you are a travel nurse and you didn't put aside all that money for your taxes, yeah, that kind of stress you don't really want to deal with. Now, what does sedentary lifestyle have to do with those blood vessels, right? Because we're still talking about peripheral arterial disease. So what in the world does a sedentary lifestyle have to do with anything? Well, if I exercise, I'm going to vasodilate. Yeah, my vessels are going to open wide whenever I work out. Oh, that's a big deal, because you should be working out 3 to 4 times a week for at least 40 minutes, right? And doing some resistance training as well. But the whole, whatever you want to do to get your body going. And it doesn't have to be that bad. It could be really brisk walking. Like, I like walking when it's nice outside. But get your ass up, okay? Because, flying a desk for a living is going to kill you. How about the poor sleep? What does poor sleep have to do with anything? Well, I want you to try a test. Tonight, when you go home, I want you to jump on the scale and take a note of what it says. And then in the morning, first thing after you pee, hopefully naked. Too much information, right? I know, the visual. Yeah, but seriously, after you pee, while you're still naked, step on that same scale. You should have lost some weight between last night and this morning. Because while you sleep, our body breaks down our fat to use as energy, because we're not eating anything. So how do we continue to beat our heart, to breathe in our lungs, and to digest whatever food, and to run our brain? Well, we still need glucose in the form of energy. Glucose is stored in your body as fat. When you go to sleep and you get REM sleep, rapid eye movement, good sleep, then your body breaks down its fat stores to supply the body with the energy that it needs to continue to work, okay? So I take sleep extremely serious. I am not going to play with my sleep. I don't need a lot, but I definitely need a good 7 hours. So because I get up at 4:30 or 5:30 every single morning, guess what time I'm in bed by? Yeah, I'm not going to be up at 10 and 11. It's not going to happen. Kind of boring. Sorry. All right. Now, you know about cholesterol, right? But let's make sure you really understand cholesterol. Let's look at it like this. I came up with this mnemonic a while back, HLTT, and I called it highlight. The highlight mnemonic, and remember, I don't do a whole lot of mnemonics because I find that they confuse you, but this one's a good one for cholesterol or for a lipid profile of a patient who is getting checked for atherosclerosis, right? So this highlight is a lipid profile. Now you have to remember this patient must fast for 10 straight hours, not 6, not 8, it's 10 or more, right? Now, when they fast and you look at this mnemonic called highlight, I want you to look at this mnemonic and work it, baby, backwards. Let's work it, baby, backwards. This T, because we're going to go backwards, this T is for total cholesterol. So the last T is for total cholesterol, and that is what everyone kind of knows a little bit about. So when we say total cholesterol, we know it should be less than 200, right? So we can put less than 200 here. And then what you do is you label the other letters. This right here is triglycerides. That's your other T. The L is that low down dirty dog, LDL. And then the H is HDL. So again, the T is total. This T is triglycerides. This L is LDL. And this H is HDL. Now, how come this works? Well, because as long as you remember the 200, all you have to do is go down by 50 each time, and you will be around the ballpark of what the normals are. So we would like to keep the patient's total cholesterol less than 200, their triglycerides less than, let's go down by 50. So less than 150. Let's go down by 50 again and keep the LDL less than 100. And then here's where things get interesting. The HDL is happy when they're high. Yeah, 420's coming up. It's a party day for us in Cleveland, right? And plus the shit's legal now in Ohio, so you won't get arrested. It's not something I like to do, but maybe you like it. Check yourself out. Occasional whatever is fine. All right, so here we go. HDL, or happy when high, is the good cholesterol, which means it needs to, let's go down by 50. If we go down by 50, we're now at 50. So it needs to be higher than 50. That's it. So watch. 200, 150, 150. Go down by 50 each time. Highlight is the mnemonic. Start in the front and move back. The first T is total cholesterol. The next one is triglycerides, then LDL, then HDL. Now, what do they mean? Really, what does it mean? To be honest with you, the most important labs on this board for highlight are going to be your triglycerides, because that is going to be metabolic syndrome. That is the #1 lab for metabolic syndrome. It is very related to sugar intake, and it is very related to stroke. Your HDL is super important. How do you increase your HDL? You move. Get yourself moving, girl. Get your stuff out of that chair and into this world of beautiful sunshine today and walk your ass off, lift some weights, do it like I do it, some planks and some squats. But really, honestly, for your elderly patient, for your patients that are typical, tell them to sign up for some ballroom or line dancing. That's what the fuck they need to do. They like it. I like it. It's fun. It's not strenuous. It's exciting and it's hilarious. Line dancing, for real, is even on the test. Okay? All right. I hope you're listening. Now, so that's the deal. So these numbers, very important. These numbers are very affected by your level of activity and your diet. You're not going to have any triglycerides, because I know I don't. I have like a triglyceride level of 36 because I don't eat a lot of sugar. That's what causes it. Triglyceride, glycerin, glycogen, sugar. Okay. Non-modifiable risk factors. What are things there's nothing you can do about? You just might as well accept it and try to look and focus on the ones you can modify. But what are those? There's not a lot. I mean, there's not a lot we can't change, but let's look at what we got. Non-modifiable risk factors for peripheral artery disease caused by atherosclerosis include your age. The older you are, the more likely your blood vessels have some atherosclerosis, which means there's plaque inside of a thick, hardened vessel wall, and there's this fibrous plaque inside of that vessel wall. And over time, as you age, that becomes calcified and can lead to a problem. And you can't do shit about it. I'm an old goat, okay? I'm 60, whatever. Male. If you're a male, this is going to be your issue more so than female, but females, you're trying to catch up. Family history or genetics, you can't pick your mama and your daddy, just let it go, honey. And then the race, Black and Latino, okay? So that's just is what it is. Now, is there something different about our blood vessels? Not necessarily, but over these years and through anthropology and the different stresses, if you look and think about this higher, this above the non-modifiable risk factors is your modifiable, I think you would agree that for at least 400 years, we might have had a lot more stress on us than some of our Caucasian counterparts, just saying. All right. Now, if we look at some of this other stuff on the board, I want you to know that there's something called co-morbidities. Co-morbidities is if your patient has peripheral artery disease, what other conditions might they have at the exact same time that may have even played a role in the development of peripheral artery disease? Diabetes is number one. This patient most likely has hypertension. They may even have some chronic kidney disease. They also may have some inflammation automatically coming from autoimmune disease called rheumatoid arthritis. And here's one you may not have known. They may be a patient that has had long-term use of antipsychotics, because antipsychotics raise blood sugar and blood pressure and can cause metabolic syndrome. Now, we already know what the complications are. They include heart attack, which is your myocardial infarction, strokes, and even TIAs. Don't forget that CVA, cerebral vascular accident, is a stroke. TIA is not. Don't even call it a mini stroke. I know a lot of you do, but that's not a proper terminology. It's a trans-ischemic attack. It is temporary. It will not cause permanent disability. And do remember that CVA or stroke is the #1 cause of disability in the United States, okay? So those are some of the complications. Now, your patient may be a little complex. So when we're looking at, does the patient have an arterial or a venous issue? Sometimes it's a good idea to think of the 6 or 7 P's as an arterial issue, and think of the mnemonic that I've come up for a lot of things called STRAW. I'm going to go to the venous side first with my mnemonic called STRAW. Okay, you ready? If your patient has the blue stuff, that's not peripheral artery disease. That is venous insufficiency. So we're going to go to what the patient shouldn't have, okay? That's what we're going to go first, because the name of this lecture is peripheral arterial disease, and they don't fit the blue side. They only fit the red side, because red is arterial. Here we go. The STRAW. straw. S is for swelling. T is for tender. Notice I use the word tender, not outright outrageous pain. No, I said tender, okay? R is for redness. The A is for what might be needed to treat it, which is your anticoagulants. And the W is for warm. And then I added flaky brown skin, even if you're white, okay? So swelling, tenderness, redness, anticoagulants, warm and flaky brown skin is all venous. That does not fit peripheral arterial disease. It doesn't. Okay, stay with me. Now, what is that called? Well, it's called venous insufficiency. Let's stop here and look at our arterial side. Let's stop right here and compare this with the patient that has arterial disease. Let's look. Where there is swelling for venous disease, there is no edema or swelling for arterial. Where there is tender areas for the venous patient in their extremities, particularly legs, like a DVT, think of that. There is severe pain on the arterial side, not just tenderness. No, boo, severe pain. Okay, where there is redness, there is pallor and cyanosis on the side of the arterial patient. They may not have much color to their extremities because the color of blood is red and they don't have a lot. Now, what does happen is if they dangle, and you'll see that down here, if they dangle, then they get something called rubor. And I actually used a deeper red color to describe that. When they dangle, they can have rubor, which is a deeper, darker red. That's when they dangle and try to get blood down there. But ordinarily, if they're not dangling and trying to get the blood flow to move down, they're gonna be kind of like not that great a color, maybe even some bluish cyanosis areas. Okay, their capillary refill, which remember the difference, is less than 3 seconds in an adult, but it's less than 5 seconds in elderly. Their capillary refill will be poor, which means it'll be way greater than 3 to 5 seconds. Okay, so that's the arterial side. We use anticoagulants for the venous patient. We might be using aspirin and antiplatelet aggregates like clopidogrel. Did you hear what I said? I said clopidogrel. You got to know that. I'm telling you, you better know that name. What is clopidogrel, Shelly? You ought to know that. But I'll go ahead and be a nice little teacher and tell you, Plavix. It's Plavix, hunty. Okay. So aspirin or antiplatelets, because aspirin is an antiplatelet, but you might want to go deeper and get that clopidogrel written down. What about where there's warmth on the venous side? What's going on the arterial side, Shelly? Oh, well, coolness. Yeah, your extremities are cold. These people want to sleep in their socks. You know these people, okay? It's called venous insufficiency for the venous side. It's called peripheral arterial disease on the arterial side. What are some examples of peripheral arterial disease versus venous insufficiency? You better know this one. Intermittent claudication. It's when your patient says, I don't go golfing anymore because I have too much pain in my legs. I can't go to the malls anymore. When I go to the malls and walk all them daggone mall shops and trying to go and do my little thing, I'm in too much pain. I have to sit down because my legs hurt so bad. Those of you in my class remember when we watched Khalif Browder's story on Netflix, you remember that his mother was making like all these trips to the jail 5 times a week, and she was in a lot of pain because she already had diabetes. She had had 2 heart attacks, and she was walking and doing all this stuff, and it was causing severe pain in her legs. She said the pain was so severe she would bite her lip to keep from crying out. My God. Okay, so that's called intermittent claudication. Okay, now the pulses in the patient with arterial disease might be weaker, and that's important because that's going to get us to the next step of remembering in our brains on this test something called 6 P's. I'll show you in a minute. Hairless extremities. Now look at this. Intermittent claudication for arterial. On the venous side, just remember the V better be in the word. Deep vein thrombosis, venous thrombotic event. That's what the venous issue is. And remember, the last one is pulmonary embolism. And when we talk about pulmonary embolism, please don't forget, beloved, that 100% of all pulmonary embolisms were caused by a DVT in the leg or the arm or the pelvis or somewhere. Okay, there's no such thing as a PE without a DVT. So if you were to say that like really like as easy as you could, 100% of all PEs were caused by a DVT. If you don't have a DVT, it's kind of impossible to get a PE. So those are all on the venous side, okay? We said weak pulses, and it's 6 P's. We're going to talk about the 6 P's in a bit, but we said weak pulses for arterial patients, strong pulses, very strong pulses for the patient with venous disease. In fact, that's why we use a Doppler to see if the pulse is really strong, and then we know, oh, this is a venous issue. Hairless extremities. Remember it like this. If there's no water, grass won't grow. Well, if there's no blood, hair won't grow, okay? So if the patient is not getting perfusion to the legs, hair is not a necessity, so the body prioritizes whatever little bitty blood flow it can get to supporting that limb. And it says, screw the hair, okay? So you're not gonna have hair on your legs, okay? Which I know females, that's good, right? Okay. Now, there's different types of ulcers depending on if you have arterial or venous disease. If you have arterial disease, those ulcers are usually very well bordered. Like they're round, they're deep, they're usually ulcers on the plantar portion of the feet and above the toes, on top of the toes, okay? And then, and sometimes underneath the toes, but definitely on the toes, with a dry yellow base. Like you'll see a dry yellow base at the very deepest part of the ulcer. It won't be, you know, bright red, bleeding, draining, nothing. It's dry, okay? That's important. Oh my God, that's important. What about the venous patient, the venous insufficiency patient? What kind of ulcers do they have? Well, first of all, let's go back to the hair. There's no change in the hair distribution. There's hair on the legs, okay? For the ulcers, you got to know this language. So stay with your girl. It's going to sound like I'm doing the whole German thing, but I'm not. I need you to stay with me. Medial malleolus inner ankle with stasis, draining, and irregular bordered ulcers. So yeah, these are irregular bordered. They're always draining because why? What did we say? Swelling or edema, that's water. So anything venous has more water, right? So swelling and edema and inflammation is water, right? Okay, that's what water, I mean, that's what it is. And so these ulcers are always draining. They're always usually on the inner ankle of the patient. And they are very characteristically horrifying because they require dressing changes. Sometimes we put an Una boot on this patient. Remember that word, Una boot, for venous stasis ulcers. Okay. Now, what are some things you can do? Well, we're going to go into that deeper, but let's just give you a few easy things. So we said this is the red side with arterial, so let's try to help it out with some blue things, right? So let's dangle the patient before they get out of bed. Let's get that blood flow going down to those extremities. Never, ever should they have tight socks, stockings, tent hose, nothing on, because you already have decreased perfusion. You put those tight ass socks on, they're going to have no perfusion. Okay. They need to walk. Here's what they're not going to like hearing. They need to walk 8 to 10 times a day. Each one of those walks needs to be 10 minutes each. When they feel pain, they can stop only for 3 minutes, and then they need to get back up. Why, Shelly? Well, because walking does what? What do we say it does? Vasodilates and gets more blood to the tissue. We even talked about Khalif Browder's mom probably prolonging her life because she had to visit her son in jail. She had to visit Khalif Browder 5-6 times a week in jail. So what happened? Well, she was walking. She had pain. She was biting her lip. It was so painful. But she was extending her life in a way because she had vasodilation. It's kind of weird how that happened on that movie, on that very true story. I hope you get to see it again. Under Time magazine, Khalif Browder story. It's a good one for you. It has every psychiatric diagnosis you ever want to cover. So while you're trying to learn psych, that's the best application of it in a movie that's real. Okay. Anyway, I told you, I promised you I would do the 6 Ps. I also want to give you some more arterial disease kind of things that affect people's extremities. Raynaud's. Yep, that's arterial. Compartment syndrome. Look, y'all. Compartment. What's it got in the middle? Artery. Compartment syndrome. That's arterial. That's all arterial. And you know that because compartment syndrome has problems with all the P's, right? So let's remember, you know, it's a lot of different ways to do the P's. I'm going to do a lot of different things with the P's, but you'll get it. So let's look at the 6 P's, 7 P's, maybe a few P's in there. Paresthesia, which is that numbness and tingling that makes you feel like you have pins and needles. It's like when your limb falls asleep. It's called paresthesia, okay? Pain, remember the pain is it is not going to be, it's unrelieved with medication. Pallor, meaning lack of color. We said that already. Paralysis. You can get to the point where you can't move it because it's necrotic. And so it's affecting how well you move. This is all arterial stuff. And then I say polar bear for the fact that that extremity is cold. And pulselessness, right? Either weak and diminished pulses or none at all, at which point we're going to start thinking, oh God, do we need an amputation? And then just remember, poor capillary refill is another one, okay? I mean, you know, just think of the P's, okay? Now, I hope I was clear. I'm looking at my little board, making sure I covered all this shit. Yeah? And again, everything in this list increases the risk of atherosclerosis. Watch this. Everything in this list accentuates or influences how fast atherosclerotic plaques will develop. Now, I'm done. It's Sunday. I'm going to enjoy the rest of my day. Probably fill a few orders for 8 pink packets, right? 8 for 88, 7 for 77, 6 for 66, 5 for 55. Woo! Okay, I don't know where that came from. I'm going to go now. Deuces. I'm done.